Hi everyone, good morning. My name is Carissa, and today I will just be giving a little update on where we're at with the COVID-19 vaccine distribution and also some updated recommendations for masking. So currently we're still in phase 1A, so we're focused on vaccinating healthcare workers and long-term care residents. People 65 and over are also being vaccinated right now. In terms of who's next, the next phase is phase 1B, tier 1, and this covers essential workers in education, childcare, emergency services, and food and agriculture. And according to the state public health department, this next tier should start on February 26th, and this may change depending on the availability of the vaccine. So recently, San Francisco has started using these mass vaccination sites where they're vaccinating, where they're hoping to vaccinate thousands of people per day. In terms of who's eligible, if you're a healthcare worker or you're 65 and older, you should be able to schedule an appointment. Like Dr. Diaz said, the vaccines are free, and you do not need insurance to book an appointment. So one of the vaccination sites that is open is the Moscone Center South, and this is in the SOMA district. Healthcare workers and people 65 and over can book an appointment. This is a walkthrough site that's open 7 days a week, and this is the address. If you want to book an appointment, you can head on over to this website listed here, myturn.ca.gov, or you can call this phone number to schedule an appointment. If there's no availability, don't worry, just go ahead and keep checking. New appointments will become available every day, and these appointments will be booked 3 days in advance. Another vaccination site is at San Francisco State University. Right now, this is for people 75 and older, and this is open Wednesdays and Thursdays during the month of February. And if you want to schedule an appointment, you can go to mhealthsystem.com/SafewayCovidSF. Another vaccination site is City College, and this is actually a drive-through site. So it's a little different from the other two, and this is for people 65 and older. And you can schedule an appointment online at this website, and new appointments are posted regularly. All of these links will be provided in the description of this video, and also later I will have a little QR code where you can scan, and all of the links will be available there. So if you are 65 and older, you also will be able to schedule an appointment through your healthcare provider. So if you are a patient at Kaiser, you don't have to contact them first. They will contact you when a vaccine is available and when you are eligible. If you have Sutter Health, they're currently only vaccinating 75 and older, but should be vaccinating 65 and older soon. If you want to schedule an appointment, you can book online at My Health Online, or you can call this number to schedule. If you are a UCSF patient, when you are eligible for a vaccine, you should receive an invitation through MyChart. You do not need to contact them first. So here is a QR code. If you go ahead and you want to just scan the screen, and a link should pop up. This will have a little menu of all of the links to these different COVID-19 testing sites. And also there will be a link called a list of all COVID-19 vaccine sites in San Francisco. And this is a link to the San Francisco Department of Public Health website, and their website is updated regularly. So if any new vaccination sites become open, it'll be listed on that website. Okay, so once you are fully vaccinated, the CDC has released some new guidelines for fully vaccinated people. So if it has been at least 2 weeks since your second dose, you have received the vaccine within the past 3 months, and you are symptom-free, you do not need to quarantine after being exposed to someone with a suspected or confirmed COVID-19 case. And you also don't need to quarantine after traveling outside the San Francisco Bay Area. And this is, as long as it's been within the past 3 months and you're symptom-free. So you should still try to be safe, continue masking, and continue physical distancing after you receive your vaccine. Okay. And if you have any questions below about questions about how to sign up, go ahead and put that into the comment and we can try to address it at the end of our Q&A session. And all of this material will be online on Facebook after the live stream is over. Okay, so in terms of mask recommendations, just a quick review. We want to choose a mask that has 2 or more layers of washable, breathable fabric. If you have a mask, you want it to completely cover your nose and your mouth and also fit snugly against the sides of your face and there's no gaps. You want to choose a mask that you can still breathe in, and you don't want a mask that has any of these vents, because if it has a vent, then you'll be able to spread the virus if you are sick. Recently, the CDC has released a new recommendation to wear a tightly fitted mask, or you can double mask to increase protection. They found that exposure to the virus can be decreased by over 95% if you double mask, so wearing a surgical mask and then a cloth mask over top, or if you wear a surgical mask with this knotted and tucked in sides, as you see here. Basically, this is just to improve the fit of the mask. And so if there are particles in the air that are containing virus, it won't be able to go into your mask as easily. And we can post a video tutorial about how to do this knotting and tucking in. And this knotting and tucking in method works best for people with smaller faces. If you do have a larger face, this knotting and tucking method does change the shape of the mask, and so it may not be able to fit completely over your face anymore. So that's just something to keep in mind. And if you don't have a surgical mask, you can also wear a 2-layer mask with a filter inside to increase protection. And then this is just a picture to show what a tightly woven mask looks like versus a loosely woven mask. If you are choosing a cloth mask, you want to choose something that's made out of a tightly woven fabric so that there are not a lot of holes in between the threads of the fabric. Okay. And then lastly, if you choose to double mask with an N95, you want to put the N95 first and then the surgical mask on top of that. The surgical mask can help to further better the fit of the N95 and also to help prolong the life of the N95 mask so you can reuse it multiple times. And if you have any questions, go ahead and put it down below. And now we will transition to the Q&A portion of our live stream.